Good morning, Fairfield and Jefferson County. Today is Thursday, May 14th. This will be our last weekly press conference for now, unless we have more significant changes. So again, we appreciate people watching it and keeping informed. Today, I have Chris Estol back from Public Health, Bryan Hunger from the hospital. We're going to hear from Calvin Todd from Park and Rec about the changes there, and Daryn Hamilton. So we'll get right with it. Chris?
Thank you, Connie. Good morning, everyone. First, I just want to say thank you to everyone in the community that continues to do the mitigation practices that we are asking everyone to do, meaning social distancing, washing your hands, wearing a face covering or mask. I actually just took mine off. It's laying over there on the table. So I said something earlier today about the health of the public depends on the actions of the public, and that is my little quote that I've decided that is pertinent to this pandemic response. So public health can't do it without your assistance, and the health of everyone relies on the actions that everyone does or does not do. We cannot mitigate human behavior. We can't mandate certain things. All I can do is ask and hope that you follow the guidance and the recommendations. There's a few things I just want to touch on right quick, and then I usually end up coming back up at the very end. So I will let you know the numbers in Jefferson County have increased. We are up to 10 confirmed cases of COVID-19 at this time. Our staff is doing contact tracing and follow-up, which is normal procedure for any communicable disease. So our nurses are busy doing that. I will let you know that 2 nurses and 1 home care aide went to Wapello County yesterday to assist Wapello County Public Health with their disease follow-ups. Our staff was inputting information, doing data entry to help Linnell Deers and her staff over there. They have significant numbers in Wapello County right now, and it's inappropriate to think that that's not going to impact our county or our community. The governor has opened up the other 22 counties that have been, quote, at a higher level of restriction. She did that yesterday. That did create some confusion and some angst with people because it was difficult to follow what she was saying and how she was implementing some of those changes. So I just encourage everyone to get on the coronavirus.iowa.gov website, and it has all the proclamations listed. So while she opened some things up, there's still some things that are restricted. So I know it's kind of confusing. I know it's frustrating. I know it causes a lot of angst with people, but we still are depending on your actions to help still continue to slow the spread of this virus. Let's see. I can say this, that the Greater Jefferson County Fair Board met last evening and made the difficult decision to cancel the fair for this summer. I do know, according to the press release, that the 4-H activities are looking at doing something different with those activities. So there'll be more information to come on that as it progresses. That decision that was made by the Fair Board was not an easy decision for them to make. And again, I just ask individuals to be respectful and supportive of all local boards that are going to be making decisions that are not easy to make when it comes to the health of the public and trying to balance business, quote, as usual, and canceling things that people really, really look forward to. I'll give you a quick update about the gown situation. We are still assisting with isolation gowns. We've given some to the health center. We've given some to an assisted living. We are still in need of individuals to help sew them. We have fabric put together in bags of, I think there's 5 or 6 in a bag with the binding. So all we need are some talented people that can sit down at their sewing machines and zip some stitches and put some gowns together for us. The goal of that is to save disposable PPE. So if and when we see a spike in numbers, if somebody's on respiratory precautions, you could go through, up to 40 gowns in a 24-hour period, depending on how many times you're in and out of a patient room. And Bryan could probably speak to that better than I can. But we want to save disposable PPE as much as we possibly can. So a cloth isolation gown is basically like a patient gown with long sleeves, and it can be laundered. So that's the goal of that. Brett Farrell was going to be here today. He is unfortunately not able to attend, but I can say this on his behalf because we talk several times a day. He continues to monitor supplies, PPE, work with our community partners, be a support system, kind of quietly working behind the scenes to make sure that especially our healthcare folks have what they need to provide care in a safe manner. He wears many hats as well, so he's unfortunately not here. I just want to say this is my legal disclaimer. If an entity has a board, like I have a local board of health, and then the board of health is appointed by the board of supervisors. If an organization or entity has a board, it will be that board's decision on how they open, what they look like, and current processes and policies to follow through. That is not public health's responsibility to do that. All we can say is follow the guidance, follow the cleaning guidance, follow the business guidance. And I know that's a source of frustration for some people, but that is not my role as the public health administrator to tell you how to open your business and what to do. You have to follow the guidance set forth in the proclamation and by the recommendations from the CDC. So I think with that, I'm looking at my notes. I just, again, want to thank everyone for all their continued support, and we couldn't do it without you. And I know Jefferson County is very blessed to have the community partners that we have, both in the city and in the county, and it's taken everybody working together. January was a long time ago. I know a lot of us met the second week of January, and here it is almost the middle of May. So it's been a long road, and I think we've done remarkably well. So with that, I'll turn it over to Bryan Hunger, the CEO at the Health Center. Thank you.
Hello. Over the past few weeks, Governor Reynolds has been removing some restrictions on businesses and activities, making a path for us to move towards life with COVID-19. Along with the restrictions that have been removed, JCHC has been expanding the availability of services also. Our JCHC clinic, our professional clinic, and specialty clinics have all started to expand clinic appointments. We are not at 100% capacity yet, but we have taken significant steps to get move in that direction. One of the restrictions removed by Governor Reynolds was on the elective surgeries. After careful planning on how to provide safety measures, this past week our operating room began performing surgeries and procedures again. We are following the recommended safety guidelines provided by Medicare and the joint statement from the American College of Surgeons, the American Society of Anesthesiologists, the American Hospital Association, and the Association of Perioperative Registered Nurses. These guidelines provide an outline on how a hospital can safely begin performing these procedures again. And so we are following those guidelines as they've been recommended. As far as safety measures, we continue at the hospital to work under the safety measures that we've had in place for the past couple months. We're still under no visitor restrictions. If you have a clinic appointment, we'd ask that you come by yourself. If you're unable to come by yourself, we'd ask that you limit support individuals to be to one of them. We'd ask if before you just come walking in, we'd still ask that you call the clinic before you come in, so that we can prepare and help know how to best serve you and protect everyone else is involved. And as you imagine, we continue to evaluate the situation, the CDC recommendations for PPE utilization and other safety guidelines to protect all of our patients and protect all of our staff in the community. So we really do appreciate, we know we have screening stations at all of our entrances, and we've limited the entrances over the past couple months. And we do appreciate the communities as they've come in for appointments and things, on being patient with our staff and being understanding and helpful in those scenarios. As far as testing, we continue to provide testing for our community. At this point, we have collected 165 tests. There have been 7 positives at JCHC, with 153 negative and 5 pending. In conclusion, we are excited to be looking forward on how to find new ways to get back to normal with COVID-19. We will continue to be responsible as we begin more services, while continuing to provide safety measures for our patients and our staff. and we'll continue to provide testing and care for our community and continue to adapt to situations as it continues to evolve. So, thank you.
Good afternoon, Fairfield. Thank you, Connie, for having me. Miss Mayor, I should say, sorry about that. It seems like it's been a long time since our doors have been open to the public. Last week, Governor Reynolds did lift the restrictions, and we were one of those counties where we are able to now open up our facility to the public. With that is going to come the restrictions and guidelines that the governor has set in place and that we will be following. We've also made some modifications to the facility ourselves that we think will help us be able to kind of take a hold of those restrictions and be able to enforce those. When you listen to the governor speak a lot, she talks a lot about phases. You know, this is phase 1, phase 2, we're moving into the next phase, and so on. We're kind of taking that same approach. We're looking at this as phases. And phase 1 will begin this Friday at 8 o'clock in the morning. Our doors will be open. And for the next 2 weeks until our next Park and Recreation Advisory Board, our hours will be from 8 o'clock in the morning until 4:30 in the afternoon. And it will be the Cambridge Sportsplex only. As of now, pools, hot tubs, sauna, all that has to still remain closed. And the Roosevelt building will still remain closed as well because we have some equipment that's in there right now that we can't move and spread apart to meet that 6-foot guideline. So in order for us to open that, we would have to be able to move that equipment, and right now we just don't have the space to do that. So what it's going to look like for when the patrons come in is that we're going to have one entrance only. It'll be on the 9th Street side, the east access. When you come in, we do require that all patrons wear a face mask, and employees will be wearing a face mask as well. We are open to Jefferson County residents only. So you will need to provide some proof of identification, driver's license, that you are a Jefferson County resident. And then we do have a 3-question questionnaire. Have you experienced any of these symptoms? Have you been out of the state? Have you been exposed to anybody that you know of that does have COVID? So once that's done, then you'll be able to come into the rec center. We do have a 45 limit capacity on patrons who will be in there, so we will be monitoring that as well. If we get to a point where we reach that limit, we will have to close the door, or we'll have to lock the doors, and we'll just say, hey, you know, as of right now, we are at capacity. We cannot hold any more patrons in here at this time. With that being said, we will not have any fitness classes right now. That is something that we are looking towards phase 2. Like I said before, we're doing this in phases. This is the first one. We're just kind of dabbling in this right now to see how this is going to work. No, I don't think anybody has a real blueprint on how to handle anything like this, so we're learning as we go. I've said with my staff quite a bit that, you know, they're probably tired of me saying this. I want to walk before I start running. So we're going to learn from this first phase. We're going to reevaluate with our board, and we might have to change some things into phase 2. You know, when we get into phase 2, ideally, we would love to extend our hours. We would love to add weekends. We would like to be able to maybe take appointments in the Roosevelt building down there in the weight room. But we need to see how this goes first. So we're going to see how this goes first. Like I said, we're walking before we're running, and we're going to test the waters here, see how this goes, reevaluate, and, you know, I hope and I pray that we don't have to go backwards, that we can continue to move forward. But I don't think it's necessarily a bad thing if we have to. You know, it's one of these things where you hear everybody say that we are all in this together, and we truly are. So Fairfield's coming together. The togetherness is very strong here, and when it's all said and done, we're going to come out of this stronger than ever. Some of the stuff that we will have available, we will have the walking track that will be available. We have cardio equipment. We have some squat racks that are available as well. And then we have some cable weight machines. A lot of this equipment was down there in the Cambridge Sportsplex area already. We've just spread it out and moved it out onto the first gym floor so we can meet those 6-foot guidelines And we've also kind of, like a lot of the grocery stores and other stores around here, they've got tape on the floor trying to control the flow of traffic. Same thing with us. We're going to try to control the flow of traffic. We want people coming in one way and exiting around another way. So if you guys have any questions or anything like that, don't hesitate to call the rec center. We'll be there. We'll be able to help you answer any questions. And like I said, our staff, along with you, we are learning as we go along with this too. So we just ask that you be patient with us, and we hope that sooner than later everything will get back to normal. Thank you.
Thank you. I'm Daryn Hamilton, Jefferson County Supervisor. The courthouse will be opening back up to the general public on Monday, and each office has its own guidelines for how their procedures will work. A couple of points that should be noted is that election is still going on at the courthouse and will still operate in the same manner, other than not having to call the number that's posted on the front or the south or north door to get in to vote. You'll be able to just walk right in. There's no restriction on the number of people that are allowed to be there to vote at one time, so there's no social distancing included with that. The remainder of the courthouse, the different offices, will be held to the no more than 10 restriction that's in place right now. Plus, there will be no loitering that's allowed in the courthouse. People that don't have specific business there that want to do different things will be asked to leave. The auditor's office phone number is 472-2840, 641-472-2840. The treasurer's office is 472-2349. The auto department's telephone number is 472-2340. The recorder's office will be issuing passports again, but by appointment only. And you can reach the recorder's office at 472-4331. You can reach Veterans Affairs at 472-3013. You can also reach the Board of Supervisors at 472-2851 and the County Assessor at 472-2849, 641-472-2849. We will try to get the best information out to people as they come into the courthouse as far as procedures at each one of the offices. If you do have any specific questions, you may call the phone numbers that I've just listed to get better advised as to what you can or can't do. Masks are not required at the courthouse, but we ask that you be conscious of other people around you, and if you have one, please wear it. Staff have been issued masks at the courthouse and have been asked to wear them, but they are not required to wear them as well. So again, we've got the courthouse opening again. The Board of Supervisors meeting at 8:30 on Monday morning will still be offered in a Zoom format. If you don't wish to attend, the supervisor's office will have only 10 people allowed in the office at the time during the meeting, but people will be allowed to wait if they have something to discuss and there are more than 10 there. So I wish to thank everybody for all going through everything that they did with our offices being open only on a limited basis by appointment here in the past, and I hope that things work best for us in the future. And thank you so much for going through this with all of us.
Thank you, Daryn. Again, I just want to say this is the last time that we'll be meeting like this unless we have something more significant that takes place in the future. City Hall plans to open tomorrow morning like normal. I think there will be a hand washing station, and you might see some barriers in front of the gals up front. But our scheduled next council meeting, which is scheduled for May 26th, will be like we've had it in the last month. However, we are going to try to open a normal meeting in June. That's our plan, where people can come in just like normal. The library has their board meeting on this Monday night, and we'll know on Tuesday morning how their reopening procedures are going to be. So we'll hear on Tuesday morning what that looks like. Also want to mention again that we do need seamstresses for gowns because we are starting to use them. Watch the Facebook pages of all these entities going forward for changes. That's where you'll find that information. And I want to ask everyone to be just extremely patient as things open up. I know that there's going to be frustrations of decisions being made, or why can't we do this, or why are they doing that? The reality is everybody is trying to make the best decision with the information they have. And, maybe somebody hasn't thought of a particular thing. So I'm just asking people to be really patient with each other and be kind, and a little bit longer while we get through this. So thanks, everyone, for coming up. Any questions, Jason? I don't think so. And anybody else have anything that they want to share? Okay, I think we're all done. Again, thanks for everybody's patience through this time at this point, and we'll look forward to a new normal and good weather in the summer so we can get out and go to the pool and do all those things that we like to do. Thank you.